Hi, everyone. Welcome back. This is the Boss Body Podcast, and I'm Sarah Haas, and I am so happy that you are here with me. This week I'm going solo. I know I often have guests on, but the topic of conversation is one that is very personal to me and one that I feel is very important. So many of you who have been following me for a while know that I am a breast cancer survivor. I was diagnosed in the fall of 2019, and I am very happy to say that I have been cancer-free for over 2 years now. And I have to say that bringing up this subject and talking about it is very scary for me. It brings back a lot of memories. It triggers a lot of the fears that I have. That was most certainly the scariest time of my life when I was going through my cancer journey. And I really don't like reliving it and going back there because I just want to put it all behind me. But as you probably have heard, October is Breast Cancer Awareness Month, and this is such an important conversation, and it is something that I just felt like would be a disservice to you as women and as my followers not to talk about it, because this is a subject that affects many women all over the world. And as a matter of fact, 1 in 8 women in the United States will be diagnosed with breast cancer sometime in their life. And there's probably a good chance that either you yourself or someone close to you has had to deal with this. And so that is why I feel like it is such an important topic that needs to be talked about. Unfortunately, I've met many women along my journey who have been through breast cancer, and I call it the club that you never wanted to join. So I hope that you never have to join this club. And I wanted to give you some information today to help you avoid it so that you do not have to go through what I went through. Because the good news is, when breast cancer is caught early, there is nearly a 99% survival rate. So that is why there is so much promotion and awareness and the stressing of early detection, because you've heard it. Early detection is the key. Early detection is the key. And that is absolutely the truth, because if you catch it before it spreads to other parts of your body, it is so very treatable. And I was one of the lucky ones because I found it relatively early. I was stage 2A, so it was in my left breast, and it had spread to some lymph nodes. However, it had not spread to any other parts of my body. So we were able to literally take it out of my body and make me cancer free. And let me tell you, I never thought this could happen to me. I never in my wildest dreams imagined that I would be a cancer patient. I thought I was doing everything right. I was healthy. I was young. I was only 47. I ate well. I exercised. I had almost no family history. And unfortunately, sometimes it can't be prevented. Sometimes cancer does not discriminate. And I was one of those unlucky ones. And I wanted to share a little bit about how I discovered that I had breast cancer, and then talk about some of the ways that you can prevent getting it in the first place. So first of all, I want to start off by saying that I had fibrocystic breasts, or sometimes they refer to it as dense breast tissue. And over the past few years, as I've talked to so many women, I'm finding out that that is very common. I thought it was uncommon and not something that a lot of people had. But I have learned since that that is not the case. And when you have dense breast tissues or fibrocystic breasts, in my case anyway, I had a lot of lumps in there all the time. They would come and go, they would grow, they would shrink, and it was really hard to keep an eye on it and to know what was going on in there. I was getting annual mammograms, and when I had my first mammogram and was diagnosed with the fibrocystic breasts, they gave me an ultrasound as well after the mammogram, because the mammogram shows the lumps, but it doesn't tell you if it's solid or if it's liquid. And the fibrocystic lumps are filled with liquid and they are non-cancerous. If the lump is solid, that means it could be cancerous. So they felt like it was a good idea to do an ultrasound after my mammogram, just to take a look at all the lumps and make sure that they were fluid filled. And that first year they were. Unfortunately, the place that I had my mammograms subsequently did not do the ultrasound follow-up. They looked at the mammogram, they saw that I had fibrocystic breasts and that I had been tested in the past with ultrasound and found to be non-cancerous, and they told me there was nothing to be concerned about and sent me on my way. I didn't worry about it because they told me there was nothing to worry about. And in 2019, I had a particular lump that was growing. However, that wasn't unusual for me. And I had been told in the past that it was possible for them to get the fluid out of the lumps if it became uncomfortable, because they were very sore and sometimes very uncomfortable. And so I had that in the back of my mind, like, this lump is kind of getting uncomfortable. It's hurting, maybe I should go get it drained. And I kept putting it off because I didn't want to go through the procedure, and the lumps in the past had gotten sore, but then they'd always gotten smaller. And not only that, it was the cost of the procedure, because as a lot of you probably do, I have a high deductible on my insurance, and so it was going to have to be paid for out of pocket. And so I ignored it for a while, but I did have a niggling feeling that this was something that needed to be looked at. This is something that needs to be looked at. And I ignored it for too long, unfortunately. And then I decided, okay, this is getting to be very uncomfortable, and I want to go get it checked out and get the fluid taken out. So I went through a series of doctor's appointments to go through with that process. And when I went they do an ultrasound before the procedure. And when I went for the ultrasound, they found out that indeed it was not fluid filled. It was solid, and that it was cancerous, and that it had spread to my lymph nodes. So a regret that I have was not listening to my intuition, my inner knowing that something wasn't right and that I should get it checked out. And the other big regret was that I did not insist on them doing an ultrasound every single year after the mammogram. And again, that was due to the cost of the procedure. I think it was probably about $400. And looking back, the $400 is a drop in the bucket compared to the tens of thousands of dollars that I now have in medical debt and the risk as far as my life and my health. So my biggest tip is, if you are one of those women out there who have dense breasts or fibrocystic breasts, get your mammogram every year, and after the mammogram, insist on getting that ultrasound because it is crucial for the diagnostics. And again, I thought this would never happen to me. So I was happy with them saying, the mammogram looks normal, you're fine, come back in a year. I didn't even want to think that this could possibly happen to me. And the sad statistic is 85% of breast cancer cases have no family history. I had very little family history, and I just never thought it would happen to me. And looking back, I regret that I did not advocate for myself and that I did not listen to my own intuition. The treatment consisted of 20 rounds of chemotherapy, so that lasted for a year. I also had 25 rounds of radiation. I had a bilateral mastectomy with reconstruction, and now I take hormone blockers for the next 10 years. It was a very, very rough road, and one that I wish no woman ever had to go through, and one that I wish to prevent as many women as possible from having to go through. And part of the reason, a big part of the reason that I had to go through so many treatments was because that it was not detected quite early enough. So I know a lot of women have fear. A lot of people in general don't like to go to the doctor, don't like to have tests run. And a lot of women are afraid of mammograms because you just want to put it out of your mind. You don't want to think about it. You don't want to worry about it. You just want to postpone and, procrastinate. Do not procrastinate. Make sure that you are getting these tests every single year. And the way that I look at it is the test doesn't determine whether you have breast cancer or any condition or not. It's already there if it's there, and it's not there if it's not there. The test just gives you the information. And if you get it detected earlier than I did, there is a very good chance that you will not have to undergo all of the severe treatments that I had to undergo. So if I can prevent anyone, even one single person, from having to go through what I did, I'm willing to shout this from the top of the rooftops. So I want to talk a little bit about different types of prevention. Unfortunately, as I said, 1 in 8 women in the US will be diagnosed with breast cancer, but that statistic is based on every woman, regardless of age, of physical fitness, of other health factors. So there's a lot that you can do to reduce your chances. Number 1 is to be physically active. Women who are physically active have a 25% less chance of developing breast cancer. So that is huge. All you have to do is walk 3 days a week, and that will dramatically reduce your chances. Walk for 30 to 45 minutes, 3 days a week. Easy, easy step. Everyone should be doing that anyway. Second thing is having a healthy diet and being at a healthy weight. Those who are overweight and obese have a much higher incidence of breast cancer. The other one is limiting alcohol. And there's a lot of studies out there talking about alcohol and the benefits of drinking wine. But on the other hand, every drink per day that you have increases your risk higher and higher of developing breast cancer. So absolutely no more than 1 drink per day, but the recommendation is actually either no alcohol or only 1 to 3 drinks per week. So that's a hard one for a lot of us to swallow. I love my wine too, trust me, but it's not worth the risks to your health. So cut back, have a drink or two on the weekend. Don't make it a regular habit, and certainly don't have more than 1 drink a day. Something else that possibly, very possibly, increases your risk of breast cancer. According to the Mayo Clinic, there are some links to hormone contraceptives and hormone replacement therapy. In my case, I had used both throughout my life. And looking back, it makes sense because those contain hormones. And my breast cancer was hormone positive, which means it was estrogen fed. And the studies are inconclusive, but they are finding some links. And of course, I'm not a doctor. You can do your own research on this topic and make the decisions for yourself. But it's something to really think about, and just a seed that I want to plant in your head, that they are finding links to these hormonal contraceptives and hormone replacement therapy. Another thing you can do to reduce your chance of developing breast cancer is avoiding chemicals. And I know it's hard to do because they're everywhere. They're in our food, pesticides, preservatives, artificial colors, artificial flavors, artificial sweeteners. But as much as you can, try to avoid these. Read your labels, buy organic, whatever is doable for you, because the fact is, pesticides kill bugs. It is poison. And the amount that the FDA allows on our food is low, but there is a toxic load. There's no studies on how much you're taking in over your lifetime of these pesticides and preservatives and artificial chemicals. So the more you're taking in, the more poison you're putting into your body. And that is just a fact. If it kills bugs, it can kill you. You also want to make sure that your water is very clean, drinking purified or distilled or filtered water. Another one is reducing chemicals in your home. And those are things like your cleaning products, scented candles, anything scented like laundry detergents, anything with chemicals in it like dry cleaning. Sadly, beauty products have a lot of toxins in them, and you're absorbing those through your skin. So trying to avoid chemicals being in anything that you breathe, anything that you touch, and anything that you put in your skin, because then you are absorbing those toxins. I said this already earlier, but get your mammograms every single year. Do not delay. Put it on your schedule. Get it done same month, every single year. Get a 3D mammogram if possible, if that is available to you. Do your self-exams constantly. Don't be afraid if you find anything suspicious to go to the doctor and have it checked out immediately. And the other thing is to advocate for yourself. And this is across the board with any kind of medical issue, any doctor's appointments, anything like that. If I had not advocated for myself, and even though the mammogram said everything was fine, I was feeling that it wasn't fine. And my body was giving me a message that, hey, something is wrong here. You're uncomfortable for a reason and you need to get it checked out. And I had to go and advocate for myself. So you don't only have to follow the advice of the doctor as far as what kind of diagnostics you need. If you feel like you need extra, get it done. Insist on having it done. And lastly is listen to your intuition. Tune in to your body's messages. And if you have a niggling feeling like I did, that needs to be listened to and followed up on. So never discount your own intuition. I hope you'll tune in next week for part 2 of this discussion. I'm going to get a lot more personal next week, and I'm going to talk about not only my journey, but the lessons I learned and how going through cancer changed me. And even if you are someone who is not dealing with cancer or never has to deal with cancer, this can apply to any difficult life situation that you go through. And it's always my passion to share what I learn with you so that you won't have to learn the hard way. So I hope that you will join me next week, because I'm going to share a whole lot more and go a whole lot deeper. And I think it's going to be a very meaningful conversation. Until then, I will see you next time. Thank you so much.